All right, and we're live. Welcome, everybody. Dr. Richard Olm, welcome to the show. Thanks so much for coming.
No, thanks for bringing me on.
Yeah, man. So I've followed your work a bit from not just Athlete Enhancement and your work in Columbus, but all the super sinister stuff. There's a great article that you just wrote from Strong First. So if people have not seen that yet, go check it out. But yeah, man, just really excited to hear more about your journey going into this world of strength and fitness and clinical work, all that good stuff.
Yeah, it's kind of I wouldn't say a long road, but I actually had been tinkering with kettlebell since early 2000s, but I never did any kettlebell training stuff. I wasn't like doing any Pavel stuff or anything. I got into strength training via track and field
Mhm.
way back in the 90s. I was a hammer thrower and was really lucky enough to get to spend a lot of time with a guy named Judd Logan, who was a
Right.
four-time Olympian. I think he broke the American record 25 or 30 times. I can't remember, but just total genetic freak, super, super strong. Learned a ton from him mentally, learned a ton from him on how to train right. Um, some of the people on the podcast might remember Charles Poliquin from kind of back in the day. So he was coached by Poliquin for 25 years.
Oh, wow.
So Charles taught me how to squat in 1996 at Ashland University in
Wow.
rural
Okay.
Ohio. And really it was weird. So I was unusually I was an English philosophy and political science major. I was totally obsessed with that, and I loved training and I loved writing and thinking, and I was just kind of obsessed with both of those, and was kind of the weird athlete that wasn't. I'm not a big sports guy. I just wanted to do those two things. But meeting Poliquin and training with Judd, and then just really loving pushing myself, I decided instead of going to grad school for philosophy, I was going to try to make the Olympics. And so, I mean, God, I won two collegiate national championships, and I was the fifth best guy in my training squad.
No shit. Wow.
Yeah, so well, Judd went to four Olympics. AG went to three. Kibwe went to two with this kid Derek Woodsky, who was the Canadian record holder at the time, and then we had me. So it was just this amazingly fun time, and your body can only handle that for so long. That's not something that you can do. Most people can do in their 40s and 50s. And so I said, okay, cool. I'll just go into this. And that just kind of brought me into the strength training world and the coaching world. And so I qualified for the 2004 Olympic trials in track and field and the 2008s. During that time, I was coaching, and that's kind of, I went to grad school at that time. That's kind of where I got obsessed with just sort of the exercise science and the biomechanics and the science behind programming
Mhm.
and training, and just really just fell in love with it and just kept doing that. And in '07, my wife was going to finish her master's in mathematics, and we decided that we didn't want to kind of play the game where you bounce around to 10 different universities in 5 years and just try to slowly crawl up there, which
Right.
that's a great. I loved strength coaching, but that just wasn't something we wanted to do.
Sure.
And so I was actually doing trade out while I was training. I had a chiropractor that did active release technique, and he suggested it to me. He's like, "You ever thought about being a chiropractor?" And I said, "Nope, never. I've had two adjustments in my life, and they were both awful. They were just from like some old school guy."
Some
So I
rack and
kind of
crack.
shadowed him, and way long story short, I decided like, okay, I'll actually go into that. And I essentially used the 4 years in school there to just fill in the gaps for some of the information that I needed regarding training. So I did almost 2,000 hours of dissection to like really understand anatomy. I studied mechanics and kinesiology and neurology and all these fun things. I mean, obviously to become a physician, but really was kind of obsessed with the understanding performance and the body. And even though I love my job now, I'm a full-time clinician here in Dublin, Ohio at Columbus Chiropractic Rehabilitation Center. I still kind of think of everything that I'm doing with patients as being, I get to look at dysfunction all day. And if you look at extreme pathological levels of dysfunction, you can recognize more subtle expressions of that dysfunction in healthy athletes. So
Mhm.
there's a lot of stuff that I teach in the classes that I teach. I have there's a rehab group I'm really influenced by called Dynamic Neuromuscular Stabilization, DNS.
Yep.
And I actually created the strength training track for that, in which we do swings and a lot of kettlebell stuff, and it's kind of blending their explanation of movement and function with what I've sort of learned from strength training mixed with what I've seen with my own patients and athletes, and then also a lot of the other courses that I've done. But the medical schooling that I got to go through was really fun to fill in a lot of information that it would be tough to have just done without it, because I wouldn't have had access to cadavers and a lot of different
Right.
rehab stuff that you can't take unless you're a clinician. So the athlete enhancement thing, which is just an education sort of platform that I've got where I teach most of my courses through, that's basically taking all of the knowledge that I've gotten from taking rehab and strength training, rehab classes, medical seminars, whatever, my experience in the clinic mixed with the experience that I had with my coach Judd or Charles Poliquin, or whoever else I got to get exposed to because of that.
Mhm.
It's kind of blending those together and trying to find a way to sort of optimize training so that we can keep people healthy, but also hit their goals. Like a lot of strength coaches, or sorry, a lot of medical providers that talk about strength training, they'll throw you a bunch of rehab exercises and say like, oh yeah,
Right.
we're doing rehab and strength training. And I'm like, no, side bridges and bird dogs is not strength training. Like that's rehab. And so blending those together, which is kind of what the DNS strength training courses are all about. That's kind of taking everything and blending them into one class for strength coaches so they can understand, oh, this is how the body's supposed to work, and this is how we can assess the body. This is how we can actually prescribe rehab exercises, corrective exercises to fix those movement patterns. And then here's how you actually load them so that they can express those patterns in whatever environment their sport demands. So it's been a fun road. That's kind of how I got, I guess, to where I'm at in terms of specifically for kettlebell stuff. Along the way in strength training, or not strength training, in training for track, just as a hammer thrower, you hinge a lot, you squat a lot, and I'm throwing things a lot. And just along the way, I ended up herniating three discs in my low back. I had retired.
Is that kind of par for the course for throwers? Is that
No,
no?
I'm not very talented physically, but I can grind and I can push basically.
Okay.
So if you looked at my vertical, or you test it, like it took me 10 months to be able to press the 48, at 228 pounds. I mean, that's not very
Mhm.
impressive. Most people that are that way, they can just pick it up and go. So, I wouldn't say I'm very strong. I can feel my body well, so my technique is okay, but like I was training with essentially Ferraris and Lamborghinis, and I'm like a stocked up Honda Accord trying to
Sure.
race these guys, and I just beat the shit out of the frame and the tires along the way. I'd do it all over again if you asked me to do it, but just it's not par for the course to have three. I would say
Right.
one or two is probably pretty typical for any Olympic weightlifter or thrower. But I had retired, was great. I had some back issues. I moved to here in 2011, opened the clinic up, got into CrossFit, which I'm not anti-CrossFit. I did it right. I wasn't like a fire breathing, I'm going to go until I black out kind of guy. Like I had already had my sports career. I liked the movements and was just doing that. Form wasn't awful or anything like that, but like I had just kept getting like consistent back pain. It was more from the exercise selection than the way I was executing those. And I'm at the gym and I said, okay, I'm just going to step back from CrossFit a little bit. So I'm at a normal just gym down the street and I'm grabbing my bag from my car and I'm walking in. I was like, that feels funny. And then I tested and I had what's called drop foot. So you can't walk on your heels. My foot just kept slapping down. Well, that's a disc herniation that's affecting a nerve root that's
Mm.
either hitting your L4, L5, maybe both. In my case, it was both. And I was like, well, that's not good. So then I had to kind of treat that and I had to step away. And this is kind of where kettlebells sort of got interjected in. I had been having consistent back pain for a long time, had been doing training, and I remember sitting on my back porch, glass of bourbon in my hand and just telling myself to just pull my head out of my ass and you're going to have pain for the rest of your life. Quit being a fucking baby about it and figure it out. And so then I had to decide, am I going to continue strength training despite the fact that was sort of the thing that caused the problem in the first
Right.
place? And I just said, of course, I'm not, there's no way I'm giving this up. And so then I went to the gym and I was just doing like traditional easy bodybuilding stuff, just moving the joints and just kind of seeing. And I started tinkering around with, doing some swings because I heard about the snatch test. So I was like, okay, I had a 16 kilo, trying to move that a little bit. But like I'd get up to the 20 kilo and my back would just start to tighten up. This is like after I'd already rehabbed the actual herniation.
Sure.
I just couldn't. It was how I was bracing, how I was stabling. I just couldn't do it. And I just kept experimenting and tweaking and trying to figure it out. Way long story short, between, just my determination to just want to keep exercising and lifting. And then, of course, the knowledge that I've learned from the rehab world, specifically from DNS, which teaches you, we give the best explanation of how to brace that I've ever seen. And I've looked everywhere.
Mhm.
Like in research journals, I've taken every seminar I can get my hands on in the rehab and the strength training world. Anything I can do, they give the best explanation of it. And it ended up being applying their bracing strategy to hinging and squatting and, the snatching and whatever, that has gotten to the point now where, I mean, I always feel like I'm just calling the gods of karma down on me, but I just did 120 swings with a 56 kilo bell with no back pain. I'll wake up tomorrow and I expect no back pain. Training for my super sinister, that took me 8 months, thousands of swings with bell. I mean, 100 unbroken swings, single arm unbroken swings with a
Yeah.
48 kilo bell, which, if you're wondering, is 2 minutes and 40 seconds of continuous swinging.
It's crazy. That's what it is.
Yeah. No back pain. I never had a single tweak the whole time. I woke up, maybe a couple days I woke up and I was like, maybe I'll be careful. But it wasn't like I was pounding a leave to get through that. I'm 47. Like I have anything that I'm going to accomplish here is going to be, I'm going to do it and stay healthy. Like I have no interest, 2004, I would have cut off my left arm if it would have got me on the Olympic team. I mean, like,
Right.
burn the left side of my face. I'll do it if I can go on the Olympic team. That's no longer the case. And so you got to be a little bit more patient, which Strong First is awesome about. Just, eat your vegetables, just stay consistent. But it really was applying what we teach in DNS with, the good technique that they teach in Strong First, which I do think is the best. I've taken all of them, taken all the kettlebell classes I've ever seen, and Strong First without question is the best one. And what I've learned from DNS and my belief and how we should be moving is almost completely consistent. We diverge a little bit, but it's just nuancy things. And
Mhm.
I think it matters, at the fringes, but I think for a normal person to go in, I think the Strong First classes are incredible. But essentially just using kettlebells, doing more single arm stuff, and applying the DNS bracing strategy to that has allowed me to get to a respectably fit level at, my ripe old age of 47,
Mhm.
without really any low back pain. And for 15 years, I had back pain 100% of the time. Maybe it was like a 1 out of 10. I can still kind of feel it. And then occasionally it was take a step, pain shoots
Yep.
down my leg and I find myself on the ground. So it was the whole thing. And now, because of two things: bracing really, really well, like we teach in DNS, and good exercise selection. So I'm doing more single arm swings and double arm swings, and just using odd objects. Kettlebells are, of course, great for that. I'm still doing traditional squatting and deadlifting and things like that, but I've tempered that down than what it was when I was training 20 years ago. And now I'm just making better exercise choices and I'm bracing better. And the result is I can still push myself the way I want to. I can get to a respectably fit level, and all without, considerable low back pain. It's good.
That's awesome. So I wanted to ask more about the bracing with DNS. That's really interesting because you said it's one of the best definitions that you ever came across, but is there specific,
The best definition,
yeah, the best definition? Is it along with the definition is a
or
specific
explanation,
practice?
not definition, explanation.
Yeah, what is the explanation of it? And like, is there specific like protocols or things that got you to feel what it's like to actually get your brace down into what you needed to do power work or specific grind work?
Yeah, I mean, so I will say this: the strong first is very close to what we teach in DNS. So I don't. This isn't. They do a great job. Sean, I think it's pronounced Carnes. God, I'm
Mhm.
like bright red from my workout
Yeah.
from 20 minutes ago. But um, so Sean Carnes gave a really good explanation of it. Talking about pushing out and meeting a punch. So a lot of
Mhm.
times when people say like, okay, you want to brace like you're going to take a punch, Sean did a good job of like explaining that you want to push out against that.
Mm.
And that might not sound like that much of a difference, but when you tell people to tense like you're taking a punch, they typically suck their belly in
Right.
and they tense their abs. So even though that cue, I think, can be used right, I thought Sean's version of it was really good. So, now like something, a drill that I'll teach, um, I have someone stand on my belly and I brace against them and I push them up. So I'm laying my back. I push them up and then I just talk in that position. So what Sean was doing a really good job of getting without getting off, way into the weeds that is oftentimes not very helpful is he was teaching with that cue, he was getting us to use our diaphragm. So the diaphragm sits in the rib cage, right? They attach it to the bottom four ribs. And when you engage the diaphragm, you concentrically contract that. Excuse me, concentrically, not consensually, concentrically, probably consensually as well. Contract the diaphragm. It essentially pushes the abdominal contents out in all directions. Okay. Now, this is the part where strong first and DNS are congruent. And so then that outward pushing force is called intra-abdominal pressure. And that's going to be the foundation of a really, really good, stable, stiff, and safe spine. And so if you're pushing out to meet that punch, you have to engage the diaphragm. That's
Right.
terrific. What you hear a lot of times, and I don't know if Strong First teaches this, I know that I don't need to whatever. They used to RKC teaches, and that's like, tighten up and then breathe behind the shield.
Mhm.
What we would get into in DNS is like, well, how you tighten up matters, right? So the idea that you would tighten your abs first, which usually is done with a drawing in or a tensing, like a co-contraction. I don't mean hollowing, like sucking it all the way in. Nobody that has ever lifted anything heavy in their life thinks that that's a good idea.
Right.
But they'll do this like cinching thing where you're just co-contracting and then breathing behind the shield. Well, that's getting the diaphragm to engage, but you've already tensed the abs and cranked your back on. And
Right.
now instead of intra-abdominal pressure being the cornerstone of the brace, you're just adding it on to increase the stiffness of the spine, right?
Gotcha.
So
Okay.
what we teach in DNS, and this is um I wouldn't say it's a way that we diverge from strong first. We're just going to dig into the weeds harder with it. But I will say I've looked at a lot of like the elite guys and they're doing the thing that we don't want. And now I have to get into understanding the balance between your posterior chain, your spinal extensors, and pressure on the belly. Okay. And you can brace with some combination of those two things. So if you're only using your back muscles and you're not using any pressure on the belly, I call that an extension compression stabilizing strategy. You see this all the time in the kettlebell world, or actually the strength training world at large. And that's where they crank their back on. Think West Side Barbell, right? Your butt back, chest up. They're just sort of sitting there, sumo box squatting is
Right.
barbell box squatting. Their chest is way up. Their back is as cranked on as you want. So in that position, they're using what I call a passive loading strategy. And that means that they're intentionally loading the passive tissue. So in this case, they're extending the spine, so they're compressing the facets together, and they're compressing the spine, which is going to add load to the discs. Now, that makes your spine stiff as shit, but the problem is it's going to produce long-term injuries that I treat every single day in my clinic. You can also then have a scenario, and this is what Westside does. They're going to extend and compress their back first, and then they're going to pressurize second, right? Because those dudes know how to pressurize. The problem is they're compressing, extending their spine first and adding pressure second. So when they do that, they make their spine incredibly stiff, but they've already loaded those passive tissues. What you want to do is you want to pressurize as the initiating event. You want to pressurize as a way to start and initiate the brace. And then you want to cinch around the pressure. The reason for that is intra-abdominal pressure is an outward pushing force on the belly. And if you turn your back, you crank your back on, that's actually a compressive force. So if you over compress the spine, you're adding pressure to your discs, increasing the likelihood that you suffer from a disc injury, or maybe it's just back tightness. Maybe it's your glutes are always, really sensitive when you foam roll them. Maybe you always pull your hamstrings, but that's all potentially discogenic, secondary to excessive compression applied to the spine because you're overusing your back muscles. So when you extend, think of it as if you crank your back on first and pressurize second. Yes, that's a very stiff spine, but you've compressed the shit out of the spine. If you pressurize first and then you activate your back second, the pressure will mitigate the extent to which the back is able to compress the spine, and it won't be able to arch quite as much. Okay.
Gotcha.
So strong first definitely uses pressure in the belly. And like I said, Sean explained that really, really well. In DNS, we're going to go way into the weeds and make sure that they know how to brace in a way where they're maximally leveraging intra-abdominal pressure, but using the least amount of spinal extensors necessary for the task. So that's way more nuanced, because remember, DNS is a rehab approach that was born in the hospital, in the Motol hospital in the Czech Republic. And then I have taken those principles of movement and applied them to strength training. So that is a critically important nuance discussion that we just had for rehabbing. It turns out it's also really important if you want to keep your back nice and healthy for long periods of time.
Right.
So for me, if I braced and I wasn't aware of that and I didn't know how to brace in a way that doesn't overload my spinal extensors, I would not have ever done Sinister. Shit, I probably wouldn't have done Simple. And there's no way I would have been able to do Super Sinister, which for those of you that don't know what that is, you have 3 minutes where you have to do 100 unbroken single arm swings with either the 32 for the women or 48 for the men. You have the remainder of the 3 minutes as your rest, which ends up being about 15 to 25 seconds, depending on how tall you are. And then you have to do Turkish get-ups one every 30 seconds for 10 rounds. So it ends up being about a 7:30 to 7:40 Sinister time, which normal Sinister is 16 minutes. But I never would have been able to do that because my back would have gotten cranked on. I got 3, beat up discs in there. And by stabilizing the way that we describe in the DNS strength training classes, you're going to reduce the load on the passive tissues. So the facets and the discs. So now I get up in the morning and I have no back tightness. That was 15 years. Oh, hell, I bet you I had back tightness every morning all the way back to, when I was 20, because I was doing so much throwing and Olympic weightlifting and squatting that like my back was just cranked on. And now, I wouldn't say I'm training as hard as I was back then, but again, because of the exercise selection, making better choices, and because I'm bracing way better. I mean, I intentionally cranked my back on in the 90s and 2000s when I was training, and now I'm bracing, and that's the foundation of I'm pressurizing, and that's the foundation of my brace. And that has allowed me to be able to stiffen and stabilize my spine for whatever I need it to do in a way that doesn't overload the passive tissues, specifically the discs.
Yeah. It's so fascinating because I think, what you mentioned there, so the devil's really in the details on it. Because I think especially if you just break, if you think bracing and like you suck in, if you do tense up, if you're at a beginning level, you probably will actually still see a little benefit in
Oh
your
no,
strength by
no, for
just
sure.
doing
That's the
that.
problem. It
Yeah,
works.
exactly. It works. But eventually you get to a level of trying to get to that next step where that doesn't work anymore, or you're just adding little microscopic injuries, which is eventually going to lead into a bigger injury down the line.
Yeah, what I tell so the to go over like two common compensatory strategies that we cover in the strength training classes. One of them is tensing. So you're kind of describing that. As I said, hey, tighten up there. If you don't add in Sean Carn's extra nuance with no, you want to push out to meet the punch, which is a critical cue. I love that cue. He was an awesome instructor, strong as fuck too, by the
Mhm.
way.
Yeah.
Do you know he's the first guy to Beast Tamer?
Yeah. It
Do
was
you hear
him
the
and
story?
Brett. Yep. Hmm.
He didn't have a 48, and they were like, "Hey, try to press that," and he goes, "Okay," and like, "Can you pistol with it?" He goes, "Yeah," and they're like, "Try a pull up," and he just did it, and he didn't even. The heaviest he had was a 44 kilo, and he just
It's
was
like
like, "All right, whatever." Like
they do it different down in South
they
Africa.
do it
So
different, yeah. But he was a wonderful instructor,
yeah,
and
great guy.
that little extra cue there gets the diaphragm engaged, right? And it's really all about, again, maximally leveraging intra-abdominal pressure. So the nuance does really, really matter. But you've got the two strategies. One is tensing. The other one is going to be that extension, compression, stabilizing strategy. And that's essentially where they're just arching their back. So think butt back, chest up if you're squatting. If you got a bar on your back, you're going to do a box squat.
Hmm.
And you're going to try to squat into the hole, but keep your chest pointed up towards the wall or even the corner. You're going to extend and compress your spine there to create tremendous stiffness. The problem is, and this is my line, it produces short-term results with long-term consequences.
Yeah.
So somebody comes in and they're doing their swings, and we've all seen this. They're like, doing that weird arch in the bottom,
Yep. Hmm.
and cool, it works great. And then over time, they start, okay, hey, I'm going to try to do simple and sinister, which is January is going to be simple and sinister month this year. So Brett just put out the newsletter that's on that subject. So then they go in and they start pushing it a little bit, and then suddenly they just their back starts getting really really tight in the mornings, or their glutes get more sensitive, or they keep tweaking their hamstring or their back, and it's not because the swings are bad. It's because the way that they're bracing is actually overloading the discs. And then they just, as you keep cranking the volume up and the intensity and the weight, then suddenly they just keep getting these tweaks
Hmm.
and they can't get around it. And it really is the bracing strategy. So in the DNS classes, because we were born in a hospital in terms of the rehab world, we're going to be more willing to go into the nuance there,
Hmm.
right? So we're like, for instance, in the classes, like we work out, but it's not like you do in Strong First, right?
Hmm.
Because those are terrific classes. But with the DNS strength training classes, those are a little bit more, they're strength training classes, honestly, for someone that's already pretty knowledgeable about stuff and they really want to dig into the weeds and they want to understand the why. So this bracing discussion that we've had is a good one because Sean did, I think, a beautiful job of explaining that to like 50 of us when I took my SFG1, in 2020 or 21 or whatever it was, 21. He did a great job. So then there's 50 people in there, and that little cue that he had, they're 90% there. But then if you want to know, like, all right, well, what is the exact sequence or what's the anatomy involved or what are the internal forces, with the extension, compression, stabilizing strategy versus pressurizing, that's what the DNS strength training classes are kind of all about.
Yeah. That is, it's so fascinating on that because I was on a Sinister journey for most of this year. I paused for a bit because I kept tweaking my back in the evening, and it
Let's
just
fix that today.
I know like it kind of demoralized this. I'm like making notes for myself of working
Where'd
on
you get?
things.
How far'd you get? Well, fuck, what's your body weight first?
Well, I'm a light guy. I'm like 151. So
Oh fuck, that's
yeah,
so totally different. Like that's not.
it's
Although
a
I'm
different
trying to
type.
do a 60 kilo, which is it's probably similar for me moving a 60 kilo.
Yeah, it's a different strategy because like the weight is you can handle the weight. I've been swinging for a long time, but like
It's 2/3 your body weight.
those little extra spots where like just gets those little tweaks and training early in the morning, it's like when things aren't warmed up as much, it started to just get a little bit extra. But I'm like thinking, I was like, I think it's more there's a bracing thing that I can work with
The
on this.
bracing one can make a big difference. And then one of I only train, I have to be up for at least, your discs take about 3 to 4 hours to kind of wake up in the morning.
Yeah.
And so if you're getting up in the morning and you're like getting to the gym at 5:30 and you've been up since 5 and you're going to try to plow through 150 swings with a heavy kettlebell, that for some people that's asking for trouble.
Yeah.
So you might, if you can find a way in your lifestyle to, best case scenario, all your training is after you've been up for a little while. At the very least, maybe you try like, all right, the days that I have to do heavy swings, you can go ahead and just do those swings in the afternoon. And on the days, I don't know how you're breaking, we can talk about how you're breaking up, but if you've got the Turkish get-ups down and you're just trying to maintain those, or you're breaking them up in the beginning, because like when I did it, especially for Super Sinister, I didn't actually do a lot. I did my capacity TGU work on one day, and I did my swing and my assault bike intervals on the other day to get more metabolically fit. And so if you break those up, like maybe you do the Turkish get-ups in the morning because it's not that bad. Whereas like pretty heavy swinging, especially if you weigh $150 and you're trying to move a 106-pound kettlebell, I mean, that's like,
Yeah, it's a good time.
I think the lightest dude that's ever done it was in the upper 140s.
Yeah, and then my buddy, my former partner Chris Abbott did it, and he was about like 160 or so. So it's, I mean,
That's just, dude, that's insane. Like that is so impressive.
it is. I mean, it's definitely a challenge. It's something that pushes you. I think it's a great challenge for anybody to go into because it gives you a very singular focus of something that is going to push you metabolically as well as, strength wise from there. I've seen more women crush it out than I have guys.
Well, it's because I think it should be one bell lighter for them. I don't think it should be two.
Yeah.
Because my wife's she's testing Sinister this weekend, and she can just demolish the get-ups with a 28 kilo.
Yeah.
Like demolish them. So she right now is doing 15 Turkish get-ups with the 24. I was like, just get good with the 24. Don't worry about doing a 28 anymore. But then you got Jackie
Vasquez. Yeah.
Yeah, Vasquez. I didn't know if she's famous in the strength. She's strong as fuck.
Yeah.
But she I had her, I did a double Sinister the other day because they didn't have a heavy kettlebell. So I was like, sure, we'll just see how this goes. And of course, she's like actually physically talented, unlike me. And she just did it with the 7. She did 28 kilos, just did a double Sinister with get ups and everything with the 28.
Yeah.
So I actually think with the 32, my bad. I think Sinister should just be the 32 of the women personally. I mean, I think it's a doable thing. I see their logic. If they really, if you want to do it, I think they could make the get ups. You could do it with the 28. Like I think my wife she could with a little bit extra training.
I do as well. There's been a few conversations on this podcast of going over this specific thing. And, I think it's as well. It should be a push challenge. I mean, and that's, 32K get up, and that's no joke from there. 24 is still no joke, but it's a little bit more manageable from there.
I mean, the numbers.
I think it's 72 men, like 130 women or something like that.
Yeah. I was going to say, because my introducing Super Sinister article, I talked about how many there was. It was about 200 people.
Yep.
And it was over 100 women, which great, cool. But then, I mean, who knows? Maybe they're just more motivated and want to do it. I don't know. But what do you think? I mean, I've gotten 6 people now to do Sinister. All of them, it was the swings. I have not found anybody yet where the get-ups are the problems. And those people are going to be the ones, if you don't have overhead mobility, you're just fucked. Like, if you can't get your arm comfortably overhead, you're just never going to be able to hold a 48 kilo bell overhead. But if you have the overhead mobility, I just have never had anybody where the get-ups were were the issue. It's
Yeah.
always the swings. Have you seen anybody where the get-ups are the issue?
No, it's so I've usually found with people, I've trained a lot for simple, and the get-ups are usually the one. As soon as you get through two get-ups after the swings, then you know that they've got it. Just
I
because
tell you, if you got so I have like my left wrist isn't quite as strong as my right one. So if you get tired, it'll fatigue quicker. And I tell people, I was like, your first two get ups after the swings, and then your ninth get up. If you like, my wife
yeah,
doesn't care. She's like, she was on the 2004 Olympic team. So she's an actual athlete. Jackie probably doesn't care. But for me, I always start on my left because my right, if I can get on my left, I'll be fine on the right.
same.
And I tell people, like, your first two get ups after the swings and then your ninth get up, those are going to be your hardest ones.
Yeah. I saw the same thing. No, I mean, doing a swing test like that, I mean, it's like doing a heavy snatch test. Like your hamstrings are going to be on fire. Like that grip, that forearm is going to start to burn a little bit, and your lungs are going to start. There's a lot of different modalities that are going in. And with the swing to get it to that chest level and maintain that pace, because you're probably getting like a 1-to-1, work to rest ratio. It's usually about
You're all,
14,
yeah, yeah.
15
I was
seconds.
17, 13. I was almost,
Yeah,
yeah.
and so when I was working on it, actually, I was working on slowing down my swings, of actually making it extend longer for shorter rest time.
Where are you,
Because
are you doing that with just trying to really maximize a float phase?
so what I was finding is when I was training, I was pushing a 90-100% effort on the swing to make sure I was getting to that height
Oh, you
versus
just dialed that back.
I was trying to dial that back to
Smart.
get a little bit more of that float, so you actually get a little bit extra rest time, so my heart rate wasn't jacking as
Yep.
much, so I didn't need that rest. It's a fun challenge to go into because the devil's in the details, and being a lighter guy, like it's pushing some fun weight that's
Different.
going on there. So I was getting to points where I was doing about 6 or 7 rounds and kind of building up and trying to go for a peak. At that point, I had
Can you swing a 48 or were you on like the 40?
no, I was swinging a 48. Yeah, I was
Dude,
doing a
that's it,
time.
dude. That's amazing.
Yeah,
I
I
don't
was
give a
doing
shit if you were doing sixes. Like, that's amazing.
yeah, I was getting into a timeless of about like around 10 minutes, a little bit less on the 48, which was feeling
Dude,
really
it's
good, but
two-thirds your body weight, bro. I
I
mean,
know it's a good time. No, it's
I
definitely
weighed
fun.
two, I weighed 228 the day I did Sinister.
Yeah,
So it's less than half my body weight. That is a humongous difference.
yeah, it's
So
fun.
if I can get my 60 kilo, well, I don't know, it'd be, by 2040, if I can get a 60 kilo one, that would be close. But
Yeah.
like, you're basically trained. Think about that. So your body weight, the one standard for all or whatever, okay, it's 48 kilo bell. Cool. What do you weigh? 52 kilos?
Mhm.
No, you can't
No,
weigh.
no, no. About
You weigh
70.
70 kilos. Yes, you're doing 70 kilos and you're moving a 48 kilo bell.
That's a
That's
good time.
nuts. That's totally nuts. I'll be maybe no, there's no way. If I'm doing a 60 kilo, I'm gonna get fucking big and strong and I'm gonna eat a lot. No, so I'll weigh like 105 kilos and I'll be moving a 60 kilo bell. I mean,
Beautiful.
so
Yeah.
what you're doing is even harder than that. It's cool.
Yeah. What's the biggest difference of training for the 60K versus something like Super Sinister? Like, is it much different? Is it just about getting stronger, kind of putting the
So
reps in, or?
the 60K is the same as training for Sinister because despite the fact that there is a metabolic component to Sinister, it's really about strength. Like, if you can just get stronger and you can get there, great. And the same thing with the 60K. So for me, I've found that it takes me, again, I'm 47, so I have to go nice and slow. I don't want to wake up with pain. I'm not pushing through that shit anymore. I did that in my 20s and that was cool and it was fun, but I'm done with that. Um, so I don't train when I'm in pain. Now, I will tell you, if I always have to caveat this because a lot of rehab guys are like, you should never train with pain. Well, my line is if you say you should never train with pain, you've never actually trained in your life. If you're actually training for something where where the priority is achieving maximal physical expression in something versus longevity, then you have to be willing to dabble with some pain. And anybody that says you should never do that, it's a fun line to say, but they've never trained in their lives. They've never actually pushed themselves. I am not that person. So I am training for health and longevity, and I'm using Sinister, Simple, originally Simple, then Sinister, then Super Sinister, and now whatever 60 kilo Sinister as secondary goals to like just put a carrot in front of me to like keep pushing myself, right? Because training is so much more fun than exercising. Exercising is just showing up and you move for a little bit. But if you're training for something, as obviously, if you're training for Sinister or you've done Elite, to do that, like you're going to push a little harder. You're going to like, have one less drink or cut alcohol out completely or focus on your sleep or, it's great. And there are these great ways to sort of push you to do that. But to get back to your question, Sinister and even the 60 kilo is really about strength. So what I found, it took me about 3.5 months to go up a bell just safely. And that's swinging. I tinkered with 3 days or 2 days, and I am the get-ups. That's one of my wheelhouse movements. So like the get-ups are never really a problem. So I was doing get-ups once a week, and let's say I was swinging 2 or 3 times a week. Now I'm only swinging twice a week because I don't think swinging, like I'm swinging a 50 kilo. Well, I tweaked my shoulder 2 weeks ago, like I mentioned before we started recording. But when I was doing, I don't think I should be single arm swinging 56 and a 60 kilo bell 3 days a week. So I dropped that down to 2 because the intensity is so high. I needed to lower. Needed to get compromised. But Super Sinister is all about capacity. So it's weird to say I'm writing the article on how I trained for it right now. That's going to come out in January on the same Strong First forum, or not the forum. It'll come out in I think the main article. Like being able to do what I said in the first one, a ho-hum Sinister, meaning like at any point you're just going to do Sinister. That is a prerequisite for training for Super Sinister. So I was in, and again, I'm not showing off here, but like I had been in what I call Sinister shape for 6 months or more before the idea popped into my head to try to do this. So, that one is really about capacity. So for that one, I was only swinging twice a week. I was always swinging 100 or more. I just started lighter, the 50, the 24, and then I just kind of moved up. And I did more like the classic Strong First methodology, which is just like, I don't know, do 100 swings until you feel like you can do 110. Do 110 until you feel like you can do 120. Like, just slow improvement here. And, I did that, but I was only swinging twice a week. But what I had to add in was those anaerobic intervals. I use the assault bike a lot, again, to save my back. The rower's another great one because you're loading the hinge again. And metabolic capacity is somewhat movement specific. So Lance Armstrong's 88 or whatever his VO2 max is not going to be as applicable with running as it is on the bike, right?
Right.
So I use the assault bike to save the back, and then I just kept doing repeat efforts of zone 5 intervals. So sometimes it was 5 minutes, sometimes it was at the end it was 3 minutes. Basically the swings take 3 minutes. So I would do the swings, I would rest 3 minutes, and then I would do 3 to 5 intervals of 3 minutes work, 3 minutes rest until either I didn't feel like I had one more in the tank, or a more accurate way to do it is I wear a heart rate monitor every time. My 60-second reduction in heart rate has to be over 12%. So if my heart rate drops by only 10%, I'm not recovering fast enough. I'm done. I just shut it down. And so the Super Sinister is just all about metabolic output, capacity training. And that also like applies to the work capacity in the swings, or sorry, the get-ups. Doing a get-up every minute, I'm sure that you on average are doing a get-up between 18 and 22 seconds.
Like 20, yeah, even 25 if taking your time.
Yeah, and that's like you're like pausing, making it look pretty, rolling through it. So that's still that's better than a 1-to-1 ratio. Well, when you're doing this, you're basically, let's say it takes you 20 seconds to do a get up. Well, then that means that you only have 10 seconds of recovery. So it's a 2-to-1 work to rest ratio, which is violently different. And so then what I noticed is, even though I could do at the time when I started it, I could do a 68 kilo get up. I could do a get up with a 150 on both sides. But, by the seventh or eighth get up, you're just like, I'm fucking tired. And, you have to follow the golden rule of Turkish get ups, which is don't ever attempt a Turkish get ups you're not certain you're going to finish. And so then I had to be really cautious about it because, again, I didn't want to get injured. So the Super Sinister is really about just pushing capacity. You are way more fatigued in that one than you are with Sinister because there's just no rest. Another difference too we can talk about. The article will come out in February on how my swing changed for training for 100, right? So a lot of people, there's a bunch of things that changed. One of them is you just have to have the most amazing float phase ever, right? So the way you get a good float phase is a very strong leg drive out of the hole. So you get tall really fast. And then the most important part is you have to wait a really long time before you go into what I call a hinge phase. So I break the swing up is you've got you're in the hole. You have, your drive phase, you have your ascent, you have your descent, which is your float phase. Mm-hmm. Then there's a hinge phase, and then there's a squat phase. And I know we don't like saying squat in the strong first world, but like Brett calls it an athletic hinge.
Right.
But what I mean by squat is there's a motion where the bell and the butt go backwards. Well, you have to wait as long as possible before you hinge forward, because the moment you hinge forward, now you're under tension and you're working. If you're in a float phase, you're resting. And so when you're doing 100 of them in a row, the bell, you starting and the bell's this much farther in front of your belly than, if you mm-hmm. pull it back here, it's a massive change in your metabolic output during that effort. Mm-hmm. The other one is it puts you in a much, much better biomechanical position to save your spine and reduce the intensity of your brace. Right. So a late hinge is a hugely important one. And then the other one is I actually shortened the stroke on my squat phase, or the bottom of my, whatever. I don't want to get into the nuance of squat or not mm-hmm. squat or whatever, but I shortened the stroke of my swing. So a lot of time, like when I went to SFG2, I was training for Super Sinister, and they kept saying, again, in the nicest way possible, they're like, oh, you need to squat, you need to get lower in the hole. And I'm popping it up fine, and the guy's like, yeah, you're powerful enough, you can do it. But metabolically, if I'm having, let's say I move an extra 50% into the hole, that's just 50% more work. And if you're going to do 100 swings in a row, I just can't do it. I'm not that talented. I'm sure Jackie Vasquez could just grab it and go, but I have to really dial in and maximize stuff because I'm just not that physically talented. So I have to be really good with the technique. And the way that the technique changed for doing 100 unbroken swings was a really, really late hinge and also a shorter stroke, or whatever you want to call it, squat into the hole.
Damn. Dude, I would love to keep going with this because we just keep rolling. I'm going to have to do a part 2 on this, but I really appreciate you jumping on today, Richard, and diving into all this stuff. This has been great.
Next time we'll have to talk about how to be 150 and train for heavy stuff. I mean, I love it. That's you're $150. So you're prep. What's your best strict press?
36.
You've pressed the 36, the 80.
Yeah.
Okay. So this is over half your body weight over. Yep. And then your deadlift, you stroked the double deadlift, right? Double body weight deadlift.
Yeah, deadlift was pretty simple on that. Bench was always the one that was tough for me because
was that 1.6?
Yeah, it's 1.5. But I never benched ever because I've been doing kettlebell work for 14 years and just, we'll do push-ups every once in a while, but it's very vertical. There's no horizontal base work.
But you got it?
Got it eventually. Yeah, it took me a few months afterwards to come back and just hone in on it, but closed it out. So.
And then what's the squat?
Squat's just body weight for 5.
That's it?
Yeah, that's it. Yeah. And then military press is 3/4 of your body
Yeah.
weight first or so. Yeah,
What's
that's
your
pretty
best
okay.
movement? So in all
Yeah,
strength training, what like you have to have a like my wheelhouse movement would be. I mean, to be honest with you, it'd be swings and get ups, but
yeah.
get ups for sure. What are your like wheelhouse movements?
Ballistics. I'll swing and snatch all day. And I'll do that with anybody. Like that's just a blast for me. It's fun. I can do it.
Yeah,
I'm powerful on it. Grinds have always been more of a challenge because I'm a light guy, but I've got long levers, so
yeah.
pressing has always been the venture, but it's just the nature of the game.
Oh, dude, it's what's so fun about this, and I can we can hop off, but um, when you get into this world of just pushing yourself, I love like CrossFit is the same thing. Like you always find your strength and your weaknesses. So for me, with the Sinister stuff, I happen to be good at swinging and get ups. Cool, but I feel like if I ever achieve Beast Tamer, it's going to take me like fucking
Yeah,
10 times the amount of time. So like I've got the press now, I've got the pistol, and it's like, all right, I'll just keep doing pull ups for
I know.
months because like I've got an ugly pull up with a 36.
Yeah.
Do you have a pull up with a 36?
I've done the 36 once before. Yeah.
Exactly.
Yeah.
I like you weigh like half my body weight,
Yeah.
and I've got like an ugly pull with a 36, and I've got a clean one with a 32, and I've been training with this, I feel like for fucking 10 years.
Yeah.
And so it's like if I ever get this,
Yeah.
I arrogantly was like, oh, I'll yeah, it's a year. I'll do it at the Dome in April.
Yeah.
False. Like that's not gonna happen. So I was like, oh, maybe I'll do it in the Dome in 2027 or something like that. Cause it's I'm just
Yeah.
awful at pull-ups.
No, no doubt. So, all right, brother. Till next time, let's do this again soon. I appreciate you, brother.
Yeah, thanks, man.
Awesome, man. So, listeners, thank you so much. I'll catch you guys on the next one. All right, peace.